For more than 47 years, our nonprofit, Resources for Seniors, has supported older adults and caregivers in Wake County. We can help in many different ways, including adult daycare programs, ramps and repairs, in-home supports, and consultation and referrals. Indeed, we're who to call when you're not sure who to call. Resources for Seniors stands ready to support you in your caregiving journey.
I'm Mark Costley, the founding attorney of Clarity Legal Group, the Triangle Area estate planning and elder law firm. You know those people who become overwhelmed dealing with the multiple challenges of being a caregiver? Clarity Legal Group helps people establish legal tools that avoid confusion, give them peace of mind, give them asset protection, and in some cases help them qualify for Medicaid. We help people get it right in the face of some of life's most important challenges. We don't just provide wills, trusts, and powers of attorney. We provide solutions and ongoing support. We provide clarity and peace of mind. It would be a privilege to help you.
Are you like 80% of seniors who would like to age in your current home? Call Wisdom Senior Care. Are you currently taking care of a loved one and finding yourself frustrated, tired, and even lonely? Call Wisdom Senior Care. Always available, dependable, and flexible. Come partner with Wisdom Senior Care, keeping wisdom at home.
Hello, my name is Stephanie Bias, the NCSMP Program Coordinator at the SHIIP Division at the North Carolina Department of Insurance, and welcome to Medicare and COVID-19 Scams. Stay safe, keep your benefits well. The North Carolina Senior Medicare Patrol Program, or NCSMP, has been housed within the Department of Insurance in the SHIIP Division since September of 2003. We exist by receiving federal grant funds from the Administration for Community Living. There are 54 SMP programs nationwide, so if you have friends or family that live in other areas of the country, there's an SMP and a SHIIP program there to help them as well. The goal of SMP is to empower seniors to prevent healthcare fraud, waste, and abuse through education and outreach. In North Carolina, all the SHIIP volunteers are cross-trained and considered to be NCSMP volunteers. The services of SHIIP are free, confidential, objective, and unbiased. There is no cost to the consumer. I want to share a story with you. There was a gentleman that was retired, and he was a shade tree mechanic and worked under the shade tree on lawnmowers in his backyard. His granddaughter loved to spend the summers with him, and she went to the mailbox, and out came a Medicare card. She took it to her grandfather and said, "Look at this Medicare card. I've heard about this." He said, "As have I." He opened it and he said, "You know what? I'm going to send this back because I'm retired from the railroad and I have good insurance that will last for me for the remainder of my life." He went inside and called his congressman's office and said, "Thank you for sending the card, but I'm going to send it back to you because I don't need those services. I've got good insurance." Well, the congressman's office said, "You have to keep that card, sir." He said, "Who's in charge of this card?" And he said, "The United States Congress actually passed an act that gave you these Medicare benefits." And he said, "Well, you can assure yourself that if Congress is in charge of that card, they'll create a government agency to oversee it." They did, and it is called the Centers for Medicare and Medicaid Services. And I promise you, there will be an agency coordinated to actually help folks understand how this Medicare plan works. That man was a man without a lot of formal education, but he was wise beyond his years. That man was my grandfather, Hill Feeser of Salisbury, North Carolina, and I was his 11-year-old granddaughter that picked up that card for him that day. He passed away in 1973, but I feel every day that I'm out there educating Medicare benefits about Medicare and how to prevent themselves from becoming victims of fraud of all the years that they worked and paid into the system for their benefits. I feel I'm honoring my grandfather's memory every single day, and that's what keeps me going. The North Carolina Senior Medicare Patrol Program has a staff of 4 full-time and 1 part-time employees. They are supported by federal grant dollars. We have a program director. We have a program coordinator, which is me. We have a program specialist, which works part-time in the western part of our state, and 2 of our communication specialists housed within the Department of Insurance Senior Health Insurance Information Program Call Center are founded and funded by the Senior Medicare Patrol Program federal grant dollars. There are 100 counties in North Carolina, Maniota, Murphy. North Carolina has a coverage map that has Senior Medicare Patrol footprint and presence in each of those counties. We coordinate with the area agencies on aging and give them grant dollars. First, to the left, where Murphy North Carolina is housed, we have the Southwestern Commission on Aging that coordinates those dollars and coordinates those services to the Medicare beneficiaries in their area. Then we also have contracts with Centralina Council of Governments, which is in the Charlotte area. We also have down in the Lumber River area in Lumberton at the Lumber River Council of Governments, we coordinate those services through their AAA, or Area Agency on Aging. Then we go to the Cape Fear region down on the coast. We're so proud to be with those folks down in those counties that serve their Medicare beneficiaries so well in preventing healthcare fraud. We go up to the north, to Rocky Mount and to Wilson, where we have the Upper Coastal Plains Council of Governments that helps us. We also go to the Carter Council of Governments, which is up at Carr Lake, up on the North Carolina border with Virginia in Henderson. We go to the Mideast Commission that goes kind of a little through the Northeast area. And finally, we end up at the Albemarle Commission, which is our wonderful Outer Banks. The other areas that are not colored and that are blue are my territory. I cover those counties that go all the way from the Virginia line all the way down to the coast. Everybody has somebody that they can call about health care coverage when it comes to fraud. You have that area in North Carolina, and those services are free. Additionally, the North Carolina Senior Medicare Patrol Program values our partnerships. Our local SHIIP coordinating sites are in all 100 of North Carolina's counties. We are also partnering very heavily with the Partnership to Address Adult Abuse, or NCPAAA. We partner with the North Carolina Senior Consumer Fraud Task Force, and my friend John Marin from the Secretary of State's office and myself serve as the co-chair for that task force. We work with the Strategic Alliances for Elders, SAFE, in long-term care on their task force. We also have a Scam Jam presentation team that has been going about the state of North Carolina for probably the last 15 years that are comprised with a member from someone from the Secretary of State's office, usually John Marin or Ann Elmore, the North Carolina Attorney General's office from their Consumer Protection Division, and I represent the North Carolina Department of Insurance. They call us the Dream Team. As of March 2020, North Carolina has 2,009,756 Medicare beneficiaries. A few weeks ago, on August the 1st, I became a Medicare beneficiary, so I am now included in that number and proud to be there. In 2019, the North Carolina Senior Medicare Patrol Program statistics had a lot of active cases. We talked to people about 894 fraud-related calls and received them in our call center, and we actually got those resolved. We conducted 1,412 fraud, education, and community outreach events, reaching 246,091 citizens. We conducted 484 fraud media events, reaching 4,190,775 people. As I said earlier, we have close to 2 million Medicare beneficiaries. So they say, you've reached over the Medicare beneficiaries that we have in the state. Well, guess what? That's wonderful. I'm glad we did, because we're reaching those folks that are preparing to go on Medicare, the caregivers that care for them, and the general public. Some facts about SMP. $86 billion was lost last year to Medicare fraud nationally, according to the Administration for Community Living, or ACL. The Journal of American Medical Association, or JAMA, study finds the annual cost of waste from fraud and abuse in Medicare alone to estimate between $58.5 billion and $83.9 billion this year in 2020. The role, as we have said before, of the Senior Medicare Patrol programs is to empower Medicare beneficiaries to prevent healthcare fraud through education, outreach, and counseling endeavors. Through these endeavors, Medicare beneficiaries become good stewards of their benefits. You know, we talked earlier that Medicare is something that you've paid into all the years that you worked, and you paid in on your FICA taxes. So you've paid into those benefits. When you become eligible for those benefits due to Medicare due to disability or Medicare due to age, you have earned the right to draw those benefits. So you've been putting aside for that rainy day to have that benefit covered, and we want to make sure that you are a good steward of those benefits so they'll remain with you for the rest of your life. Our watchwords are to protect, detect, and report Medicare fraud. There are several instances in which we want to make sure that we remind you about how to protect your Medicare benefits from fraud. Last year, in 2019 and 2018, Medicare beneficiaries received new Medicare cards with new Medicare numbers on them. No longer were the Social Security numbers on there, which we all know is a big, great target that we can use to get Medicare fraud from. If you give that Social Security number out or your Medicare number out, you've really opened the door to someone that can use that unscrupulously. But you now have a new Medicare number. It's a combination of numbers and letters. We still want you to not give out your Medicare number to anyone other than your doctor or healthcare provider that you know. We want you to protect your Medicare number and treat it, your Medicare number and Medicare card, just like a credit card. We would like to invite you to put your Medicare card face down in your wallet so someone standing behind you at the doctor's office can't go and just take a photograph of your card and use it for services. Because the new Medicare cards do not have your signature on there. Don't be upset if someone asks to see a driver's license or some form of identification that has your signature on there. And we all know that the Medicare card does not have your photograph on there either. We had a lady one day in a presentation, she said, well, I've gotten my new Medicare card and they're really going to take it because I've made a copy of it and I've signed my name across the top and I've taken a picture of myself and cut it out and pasted to the corner. We said, ma'am, you have just nullified a federal document. No one is going to take that as your Medicare number or your Medicare card to pay for your benefits that you receive. Please don't ever provide your Medicare number to anyone who contacts you through unsolicited calls, text, or emails. And that includes these robocalls that you get all the time. These folks are very convincing on the phone. When I first became eligible for Medicare, leading up to that time, I received phone calls from folks that told me that if I bought my insurance with them, that they would send me a free travel trailer. If I had gone with them, I would have received 4 travel trailers. What was I going to do with 4 travel trailers? Please be careful of folks that say they're going to provide you a prize for going with them, or you only have 15 minutes to make sure that you want that plan. Make sure that you are educated. Talk with your loved ones. Talk with your friends in your neighborhood before you sign up for any type of insurance that goes behind Medicare. Please be cautious of anyone who comes to your door offering free COVID-19 testing, treatment, or supplies. They're doing that all over the state of North Carolina and all throughout the country. Or if someone comes to your door and says, I have the best insurance for you, and we, like the people that you see on TV, can provide rides to the doctor, we're going to feed you meals, we're going to do all of this. These are ancillary benefits. Make sure that they will do what they say they're going to do, and you check that out on your own. Not to say that the person at your door is being unscrupulous, but make sure that you understand what those benefits are before you sign on the dotted line. We all know that we're in a worldwide pandemic. We all know that there is no cure for COVID-19. We know there's no vaccine at this time. But folks will call us and say, what does Medicare really cover when it comes to COVID-19? Medicare Part B, which is your medical insurance part, covers the COVID-19 test when ordered by your doctor or healthcare provider on or after February the 4th, 2020. Medicare covers all medically necessary hospitalizations, including extra days in the hospital for patients who had to stay longer because of COVID-19 quarantines. As we just said, there is no vaccine for COVID-19 at this time. However, if one becomes available, Medicare will cover it at no cost to you. Medicare has recently expanded the coverage of telehealth services to enable beneficiaries to access a wider range of services from their providers without being forced to go or travel to a facility and maybe sit in a lobby with someone who possibly could be symptomatic and have COVID. Those telehealth services include access to doctors, nurse practitioners, clinical psychologists, and licensed clinical social workers. During this emergency throughout the world, there are also more options for the ways that your providers can talk with you under this provision. This is new, and this is a wonderful option for folks. I have actually personally had 3 telehealth visits with my providers, and it has been just like I was sitting in their office talking with them. It's been a wonderful experience. And I encourage you, if you're a little bit skittish about that, going to the doctor, make sure that you call and say, is this a visit that can be held virtually? Are telehealth services available to me through my original Medicare to diagnose COVID-19? During this time, we certainly will be able to have specific set of services through telehealth, including evaluation and management visits, which would be like common office visits, mental health counseling, and preventative health care screenings. However, if it is determined that you are at risk for COVID-19, the provider more than likely will arrange for you to receive a COVID-19 test at the nearest available testing facility. The North Carolina Senior Medicare Patrol Program, or SMP, wants to make sure that you are aware of the different scams to watch out for as it relates to the coronavirus, or COVID-19. Be on the lookout for scams that could arise from the COVID-19 pandemic. And as a reminder, and don't just keep these reminders to yourself, share those with folks that were not able to be with us today at the Caregiver Summit. We said earlier, protect your Medicare number and only provide it to your doctor and Medicare providers. Be cautious of anyone going door to door to offer free coronavirus testing, supplies, or supposed treatment. Please do not fall for scare tactics or any type of time-sensitive offers. And you do not ever give anyone access to your personal information or your bank account information when they say, we've got a deal that's for you. We're working on a cure, and we can put you in on the ground level, and you will be rich before you know it. What do you do if you ever hear about Medicare scams? You always give us a call at the North Carolina Department of Insurance to our toll-free consumer line for the Senior Medicare Patrol Program at 1-855-408-1212. You also know that we have available information on our website, which is www.ncshiip.com. At this time, I want to share some information about what to do if you think you have been scammed. How are you going to know? You're going to know if you've been scammed by opening and reading your Medicare statements and checking them for accuracy. If you go to the doctor, keep a healthcare journal or make sure that you've written down what you went to the doctor for, what he saw you about, and the things that you talked about, so you will know what he is charging you on your statement. Open it and read it and check it for accuracy. You always know that you have rights of appeal. You always open your bank account information to make sure that no one has gone and retrieved any of your funds, or your credit card information. You're going to open that bill to make sure that no one has bought something that you didn't authorize, or that have stolen your information and gone on a shopping spree throughout the country or online with Amazon, for example. You know that when you open your Medicare statement and you see something for COVID-19 testing and you have not had a COVID-19 test, that could be fraud. You have the rights of appeal. What do you do about that? You call us at the North Carolina Department of Insurance at 1-855-408-1212. The North Carolina Seniors Health Insurance Information Program stands ready to help you. We have close to 1,000 volunteers all across the state of North Carolina in 100 counties that are willing to help you and are willing to sit down, listen to your concerns, ask you questions about your concerns. The thing that I want you to take away from this is our services at the Department of Insurance under the SHIIP division are free and confidential. We do not sell insurance. We do not refer you to insurance agents or say, oh, I know John Smith down the street. He's an insurance agent and he would be somebody great for you to talk to. You cannot do that, and we will not have that happening in the state of North Carolina with our SHIIP volunteers or valued partners from across the state. Many of our seniors will always ask us, well, what did you recommend for your mom or dad or for your loved ones to take as an insurance? Or how do you help them when it comes to Medicare fraud? I have cautiously advised my loved ones and my family members to protect their Medicare benefits from healthcare fraud, to detect errors on their statements by reading them and checking them for accuracy. And if you see something that is awry or amiss, always report it to us at the Department of Insurance, and we can help walk you through those steps of appeal. People say, what did you get your parents to go on? Well, my father was a railroad retiree as well, so he was very fortunate to have United Healthcare and Railroad Medicare to cover both he and my mother for their Medicare supplement insurance, as well as their Medicare prescription drug plans. They both have passed away, and as I said earlier in our presentation, I feel I honor my mom and dad and my grandfather, my grandparents, and many of my friends that have gone before that have said, we are so thankful that this program is here to help somebody understand this ever-changing and convoluted program. As you know, as I said before, we have 100 coordinating sites all across the state of North Carolina with Medicare volunteers that are trained through the SHIIP program to help you to understand what to do. This fall, and as it's going on right now, October the 15th through December the 7th, is the annual open enrollment period for Medicare prescription drug plans or Medicare Part D. We want to make sure that folks understand that the card that they loved and the plan they loved last year may be different than the one that they would get for this year. It may not cover the drugs that you take. You need to do a benefits checkup with us every year to make sure that you are in the plan that is going to help you and make the most sense and make the most valued for your health care dollars. Those health care dollars are important to you. We want to make sure that you understand how you pay out of pocket, what you pay as your deductible, what your copays are, what the formulary or the drugs are. We want to make sure that you understand what drugstores are preferred providers, what drugstores are not preferred providers, or if they have a mail order system. Our folks have been used to going to our local coordinating sites, and unfortunately, many of them are closed and will not be seeing Medicare beneficiaries face-to-face for this season that is so important to us. But that doesn't mean that that facility has said, oh, we're just going to forget everybody in our county. That is not true. You call and make an appointment, and you can, together with a Seniors Health Insurance Information Program or SHIIP and S&P volunteer, can go together and look on the website and have a confidential phone call or have a confidential Teams meeting or a WebEx meeting to understand what you need to know for next year when you're selecting a plan. They still can enroll you if you so choose in the new plan, or you may prefer to go to the company directly itself after you've heard about their plan and what your options are going to be that is best for you. Remember, as I said, the services of SHIIP are free and confidential. Many folks say, I'm retired from the state of North Carolina. I taught Medicare beneficiaries that are old like you going on Medicare this year. I had one of my former teachers to call me and say, all right, what am I going to go on? I've just now retired from Medicare, from the Department of Public Education, and I've also retired from the mail handlers because I did a second job and delivered mail. And I said to him, I said, you know what, I appreciate everything that you've done to help everybody, but you are going to go on that state health plan options for Medicare beneficiaries because you're eligible for Medicare now, and you're going to enroll in your Part B, and you're going to pick one of the plans that is through the state of North Carolina because you are a state of North Carolina retired employee as you taught school for over 30 years. He said, well, I sure am glad you told me that because I was thinking about going with this company that called and said that they would send me a gift card for Sheetz for gas. And I said, I'm so glad that you didn't make that decision. People say, do people ever stop you and ask, what am I supposed to do about this or that? I have friends that have stopped me because remember, I'm turning 65. I just turned 65 this year, and everybody that graduated from high school with me has called me on the phone. All right, tell me what to do. They may be retired from the VA. They may be retired from Duke Energy. They may be retired from the railroad or the state of North Carolina. And those are pretty clear-cut answers for what I'm going to tell them that they need to investigate as they're going on Medicare. We also tell them about the part about Medicare fraud, that they still need to read those statements. And somebody told me, he said, I've got statements from how long ever I've been on Medicare. I went on Medicare due to disability. He said, I'm not opening and reading those things. They're too confusing. I said, well, you may have lost some of your benefits because you didn't open your statements and read them and check them for accuracy. You know better than that. Make sure that you open those statements and read them. And if you see something that is amiss, call us at the Seniors Health Insurance Information Program. I met one of my best friends in the world last summer in a barbecue restaurant in Salisbury, North Carolina. It's a place where we all hung out when I was in high school. We talked about what he was going to do. He has a wife that's a retired nurse with the school system. He wanted to see what the difference would be with the drugs that he took by going with a private plan or going with his wife's plan through the state. As we're going through that process through mymedicare.gov and picking all that information up, Out of the corner of my eye, I see 4 more people walking into the barbecue restaurant that graduated with us from high school. And I said, David, have you told people that I was here doing this for you? He said, and I knew you would not mind helping them. I said, not at all, but take a seat. He gets first dibs. I do this every day because I love what I do. I love the people that I work with. I love and value the partnerships that we have with places like Guiding Lights and this Caregiver Summit. We're so proud to be a session sponsor for this event. I wouldn't miss this for anything, and I'm so thankful that we're able to have this virtual conference together this year. It's not quite as fun as seeing you face to face and all around the triangle, but we're very delighted to be here, and we hope that the information that we've talked about today is going to be beneficial to you as a caregiver and beneficial to those that you are caring for. It may be beneficial to folks who are partners that are in this session today. They may really not understand when it is that they're supposed to enroll in Medicare. They might understand all the alphabet soup about Medicare Part A, which is hospital, Medicare Part B, which is medical, Medicare Part C, which is Medicare Advantage plans that take over the management of your Medicare benefits and manage them for you, and may have a drug plan with that. Medicare is there to help you. Medicare Part D, which is your drug plan, that's an alphabet soup. It's very confusing, and that is what we do to make sure that you understand how your benefits are contrived, how we want to make sure that you enroll in a plan that is going to be best for your particular situation. You don't have to take the plan that Mary at the local coffee clutch at your local coffee shop takes, because her benefits are going to be different than yours. Her drug needs or her medical needs may be different than yours. So we want to make sure that you are informed on how to make sure you get the best bang for your insurance dollar that you have saved for. We also want to make sure that folks know about what we call the Extra Help program. The Extra Help program is from the federal government that has several layers to it, and it is benefits driven. It may help you pay for part of or all of your Medicare Part B premium. It may help you pay for co-insurances or deductibles, depending on which plan you qualify for. And folks need to apply for this, because the federal government is not going to come knocking on your door and saying, we want to sign you up for a plan. It is up to you to reach out to sign up for that plan. I had a lady who said, I am not going to sign up for that Extra Help program. You don't even need to talk to me about it. She said when it first came out years ago, she said, I went in and spoke with a SHIIP volunteer who was very nice and was explaining the program to me based on my income and assets. And she said it was higher than what it is for public assistance programs such as Medicaid. And she said, my income was a little bit higher, but I just wanted to see if the federal government was paying attention. So I applied for that, and I was turned down. And I was just incensed. I've paid taxes all these years. And I said, yes, ma'am, I understand. But I said, maybe your benefits have changed. Your particular situation has changed. Your spouse may have passed away. She said he did. And she said, and I only draw a portion of his retirement. I said, your income could have been reduced, and you've had a family status change that you may qualify for that. Her face lit up and she said, well, you know what? Let's try it one more time. She called me back to let me know she was so pleased that she had qualified for one of the tiers of Extra Help. Remember, the government's not going to give it to you. You have to apply for it. We also want to remember that when you receive information about a Medicare Advantage plan, that takes your Medicare A and B benefits and it actually couples it together under one plan as a Medicare plan that is called a Medicare Advantage plan. You may pay a lower premium for that up front every month, but there are copays associated with that. You first want to see if when you're considering a Medicare prescription drug plan and a Medicare Advantage plan, for example, if your doctors are taking that plan. And remember, doctors can opt out of these plans at will. You want to make sure that your doctors take that plan, not only your primary care provider or a specialist or your local hospital, or if you are going to have to go to rehab, to a local rehab facility, you want to make sure that they accept that plan and what your out-of-pocket expense is going to be. I always tell this story about a sweet lady that called me, and she said, she said, I have checked out everything. I live in X county, and my husband's going to have a knee replacement in the next county over at a major medical center. She said, I've been down to the local long-term care facility that has a skilled rehab component. I've gone in, toured it, talked to them. Yes, they have that, and they accept my plan. And she said, I'm so excited for that. Her husband had the surgery. He did well. He had a few complications, so he was delayed in going to rehab that is covered under Medicare. She called me back and she said, I am mad and I think it is your fault. Well, I'm kind of used to hearing it's your fault. She said, they have put my husband in a facility 35 miles the other side of our major city, and I'm 74 years old. I don't feel comfortable in driving in that traffic. She said, why didn't they put him in the facility down the street that I talked to them about? And I said, well, ma'am, you didn't sign for a bed hold, and they can't keep a bed hold. And when they were able to talk to you about your husband going there, since he had a little bit longer stay in the hospital, they had already given up that bed to another Medicare beneficiary that needed that bed. She said, well, that's not fair, because she said, I live in this neighborhood, and I bet that person's not even from this area. I said, well, ma'am, you have to know that there are no bed holes, and you got to make sure that you understand how to make sure your benefits are protected and that your husband is going to get in a place that is going to give him good rehab services so he can come home. We also have had calls about Medicare services during this global pandemic. Services from folks that say, you know what? My husband was in a facility for rehab under Medicare's benefit when the pandemic really hit North Carolina heavy in March. My husband has COPD. He has a breathing issue. He had bad knees and bad hips. He has a hard time breathing. And his doctor said, I think that you need to take him out of that facility from rehab and have rehab come to the home. She said, well, that would be great if that is what you order and Medicare approves it. He said, don't worry. In this time, Medicare's approving a lot of things that aren't under the real umbrella of Medicare. And she said, well, I really need, if he falls, I can't pick him up. He is a tall, big man, and I am a lady of slight stature, and I'm tiny. I can't pick him up. Just get yourself some round-the-clock care that will help you. Guess what? She called Medicare after she had had the round-the-clock care and said, I understand you're going to pay for this, but how are we going to file so that I get reimbursed for those dollars? They said, ma'am, that doctor should not have told you or suggested that that may be a covered service. So I'm sorry, you are out of luck when it comes to being reimbursed for that month of care. I said, well, ma'am, I'm sorry about that. I told you about that before you brought that gentleman, your husband, home, that may happen. And they also told you that at the facility that was providing that private care. You need to make sure that you understand that there are many scenarios that are out there during this COVID-19 that may sound too good to be true. That one wasn't a scam, but it did sound too good to be true, and it ended up costing the lady dollars for the private care of services. Now, Medicare did pay for the rehab services that came in and provided rehab. And thankfully, this gentleman is up and is around and is doing well and on his own. And she says, we can actually go through our local drive-in and get us an ice cream cone and sit in the parking lot and enjoy that. That's something that they looked forward to while they were housebound during this pandemic. Remember, if people call you and say that they have a hot tip on how you can make a lot of money based on a COVID-19 vaccine or a cure, that is fraud. If you give them access to your IRA or to a CD or some of your banking information or your financial information, that's a grave error because they have probably gone and wiped you out of all of your money. Please don't do that, because when that happens, we can't get that money back from you, for you. It may be someone that calls you from offshore. Remember, federal jurisdiction doesn't go offshore. A lot of these folks in these call centers that call and talk to you, they are saying, oh, we're in California or we're in New York or we're in Texas, when in actuality, they may be somewhere else. We want to make sure that you do not fall for that scam and that scheme. You may receive a call saying your Medicare benefits have been compromised and they're going to need to close your Medicare account and reopen a new one. That is scam riddled. I actually had that phone call yesterday. Someone called and said that my Medicare benefits had been scammed. And I said, oh, really? How so? They said someone has gone to the doctor and has gotten x-rays and MRIs and things like that, and they have been denied. I said, do you know why they've been denied? I don't know, ma'am, but you're going to owe that doctor a lot of money. Well, guess what? I don't have the part that covers the medical. I'm still employed and I have insurance with my employer. I knew that was a scam. They said, could you verify your old Medicare number for us and we will send you a new Medicare card? And in fact, for an extra $15, we can send you a card that is actually not that thin paper, but we can send you a card that is metal, kind of like a credit card or a hard plastic. I said, oh, isn't that wonderful? But that is not a government-approved Medicare card. That is fraudulent, and I am not giving you any money, nor am I giving you any of my personal information. We're not going to fall for that scheme. Durable medical equipment. I am amazed at every time I go somewhere that people have walkers, wheelchairs, breathing machines, everything known to man. I got sick last year and I have some pieces of durable medical equipment. And people came to me when I was in inpatient rehab and said, if you don't use it, maybe someone else can use it. No, I'm not having my benefits pay for something that I know is not going to benefit me or really not going to help me. And I'm not going to take that home and give that to someone else that might need that. Their doctor needs to order that. I don't want my doctor ordering any services or equipment that are not going to be beneficial to me. Those are the things that we want Medicare beneficiaries to understand. Read those statements, detect them for errors, make sure that you have appealed something that is not right. And if you don't understand, give us a call at the Department of Insurance Senior Medicare Patrol, North Carolina Senior Medicare Patrol Program at SHIIP, 1-855-408-1212. And the one thing we want to make sure that you clearly understand is all of the information and the tips that we've talked about today, that you share them with a neighbor that was not able to visit the Triangle Caregivers Summit and hear this wonderful information and these updates that we're so excited and privileged to be able to be invited to tell you about this ever-changing program. We also want to make sure that you know that the services of SHIIP are free. They are not talked about within the basis of the volunteers. If you get someone that is your neighbor down the street and you're there to be counseled about Medicare or Medicare prescription drug plans, that SHIIP volunteer and S&P volunteer has taken an oath that they will not go out and talk about, I saw Mary today, and did you know she was taking certain medicines? They can't be a SHIIP volunteer and do that. That is confidential information that we talk about with you and with the beneficiary to make sure that we get you on the right plan. Sometimes we will have to tell folks that we are going to ask them some questions that may seem a little bit prying. But the reason we're doing that is that we need to make sure that we give them the information and send them on the right path and not down a rabbit hole where wrong information could be confusing to them and they go out and make a choice that really is not the best choice for their insurance dollars. Remember, we lost $86 billion a year to Medicare fraud. How can we make sure that we don't continue to lose that amount of money? We need to make sure that we protect our Medicare benefits by not sharing our information and our Medicare number with folks that we don't know or folks that call you on the phone. We want you to detect errors on those Medicare statements or MSNs or explanations of benefits from your Medicare Advantage plan or an explanation of benefits from your Medicare prescription drug plan or your insurer that insures you, your former employer. We want to make sure you read those statements and check them for accuracy. If you see a question or you have a question about it, call us and we can guide you in the right direction on what you need to do about as an appeal. Remember, the services of SHIIP and SMP are from Manteo to Murphy, from Henderson to Charlotte, North Carolina. We cover the states, all the states' counties. 100 counties, we're there. We're there to help you. We're there to provide you the best information that we can and try to simplify this ever convoluted and ever-changing program. Thank you for the opportunity to be with you today. And please remember, if you've taken anything away from this presentation that we've been to today, share that with a friend or a loved one that couldn't come, or store it in your well house of knowledge in the back of your mind and say, now what was it that lady was talking about? I'm getting ready to go on Medicare in 3 years. You need to make sure that it's never too early to begin preparing for Medicare. Thank you so much for visiting us today and attending our session. It's been our privilege to be with you. Thank you for coming, but if you have questions, we have answers. You can talk to me after this session is over and ask questions. We want to make sure that your questions are asked and that you receive the answers. And maybe your coworker or your person that was attending with you, your friend that's a caregiver just like you, say, I hadn't thought of that question. I'm glad you asked. So please, bear with us. Make sure that you are patient and we will answer these questions as quickly and as concisely and as accurately as we can. Thank you.